the Rotary District 6400, and I'm Dr. Noel Jackson, and we have Richard Michael
and Maxi Candido. Margaret
and Margaret, and this is our little patient Flora. Smile for the camera. Okay, we're doing a great job here for her. We've been coming down here for 7 years now, and when we first came down here, people would come to us and they'd have severe problems, and it was like there was no end to the severe problems. So we thought if we could take care of these kids like we take care of the kids in the United States and work on prevention, maybe we could prevent the severe problems, and then we'd only be taking care of little problems for them.
We're in a school setting here, so we have a K through 12, which is wonderful. So we have all the patients that we need, and we get to do a lot of comprehensive treatment on them. We do a lot of hygiene. We bring a couple of hygienists with us. It's been a great program, and I think that people look forward to us coming every year, and it's working out real well.
Yeah, the hygienists I think are indispensable for what we're trying to accomplish here. If we could get more hygienists to volunteer with us, I think that would be great. And we're also looking for some dentists that could come down here and help us get the job done. Knox is going to become the director of the program for us. He just finishing up his master's degree in prosthodontics, and he has an abundant heart to want to help get the job done down there. So we're looking forward to making the word here would be sustainability. And in terms of trying to create better health, actually for the whole country of Nicaragua.
Also, I want to thank to all the Rotary program, and also I'm talking for the rest of the group, and I'm very thankful for all your opportunity, times, help, and thank you so much for doing this.
And welcome to the Rotary Club meeting of February 24th. It's my pleasure to introduce our president, Diva Alfaro.
Thank you, Raymond. Thank you, everybody, for joining us today. That video was very inspiring because to think it took the thought of one man back in 1905, and on February 23rd, February 23rd, he thought of bringing together business professionals with diverse backgrounds to talk and try to figure out how to help their community, how to make things better. And fast forward to now, I mean, look at what those people did. They put themselves in a position to be able to help others and create such a great change for those that are less fortunate. So that's a little bit about who we are as Rotary and what we do, and it's been this way since 1905. So thank you again for joining us today, and I would like to send it off to Mike for the Pledge of Allegiance.
Please join me in saluting the flag of our country. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mike. I didn't tell you I was going to ask you to do it, but thank you. Next, if I can have Casey lead us with the invocation.
I think Mike has a script written already for that Pledge of Allegiance that he didn't have to make it up on the fly. Let's pray. I got a good script as well. Almighty God, we thank you and we praise you for the opportunity it is to come together once again, Lord, to impact, to make a difference, to inspire, to lift up and encourage, to bless, to share hope, Lord, to be hope, Lord, to come around people and to serve our community and put others above ourselves. We thank you for the privilege it is to have a mindset that invites that and inspires us to do it again and again and again. We thank you that we are the Rotary and that we are impacting San Dimas in the world. May we continue to do so in honor of you. In your name we pray. Amen.
Amen. Thank you, Casey. So next I'd like to do brief introductions. I'll start off with myself. My name is Diva Alfaro. I am a Rotarian for about 3 years now, and I am a licensed loan officer here. I practice all over the United States. And so I'll go ahead and pass it on to Casey.
Happy to be a part of our St. Dimas Rotary. I've been here floating around 8 years. I've been a past president and filled a few other roles, but I am a health coach and leadership development guru kind of guy. That's what I do. I connect with people and help them be better people. And so the Rotary has always been a great place to serve, engage, and make our community a better place. So glad to be a part of the Rotary and look forward to what we can do today.
Thank you, Casey. I'll go ahead and pass it to Raymond.
Hi, Raymond Foster. I'm past president, president-elect, current public image chair. That makes me the face of Rotary.
Thank you, Raymond.
You're welcome.
Next, Marianne.
I'm Marianne Kistler. I have been in Rotary close to 25 years. I have been a past president. I am the current chairman of the foundation.
Sorry. Thank you, Marianne. Mike.
Hi, everyone. Mike Wallace. I am the president of Better Home Financial. We are a mortgage brokerage in downtown San Dimas. I've been with Rotary coming up on 6 years and past president, and happy to be here among people who want to serve the community.
Thank you, Mike. I see we have both of our guests here today. So if you want to just introduce yourself, Sister Terry Dodge.
Good morning or afternoon at this point. My name is Terry Dodge, Sister Terry Dodge. I am a Roman Catholic sister, and I've been the executive director of Crossroads Incorporated for the past 32 years here in Claremont.
Thank you so much for joining us today. I look forward to listening to your fast craft talk later today. So thank you again. Next, I have the privilege of introducing our guest today is Dr. Danny Kim. Danny Kim, or Dr. Danny Kim, was born in South Korea. His family and himself, they grew up in South Korea and moved to America. He attended the University of Pacific for college and dental school under the Accelerated Pre-Dental Program. After graduating dental school in 2015, he did an internship in Parkland Memorial Hospital, that's in Dallas. He attended Nova Southeastern University and to complete his oral surgery training. He moved back to Chino Hills and so he could live close to his family. And some of his hobbies, he enjoys sports like basketball, tennis, golf, and soccer. And he's an avid movie critic. So I'm sure that now that movie theaters are going to start opening up, he's going to be very excited to critique those. But I thank you so much for joining us, and you have the floor.
Thank you for having me. Really excited to be talking today. Is it possible that I can share my screen so that I can show you the PowerPoint?
Yes, it's done now. Go ahead.
It says that the host is disabled. Okay, I got it.
There you go.
All right, can you guys see my screen?
Yes.
Okay. All right, so my name is Danny Kim. I'm with Inland Empire Oral Maxillofacial Surgeons. I'm gonna start off briefly, another introduction. My family and I moved between Korea and America, growing up all the way until 8th grade, where we settled in Chino Hills and where I attended high school. And at an early age, I knew I wanted to become a dentist. And so I did the pre-accelerated dental program in the University of Pacific. So I went to college and dental school there. And afterwards, I did an internship. I found out I wanted to do oral surgery and pursue my education. So I did 1 year in Texas at Parkland Memorial Hospital, followed by an additional 4 years of training in Fort Lauderdale, where Nova Southeastern University was. And so in oral maxillofacial surgery training, you do an additional 4 to 6 years. and this includes medical rotations as well as medical training as well. And most recently, I proposed to my longtime girlfriend, and I'm now engaged and look forward to that part of chapter of my life. This is a photo of me and the docs at our practice, as well as our office manager on the left. And the other picture is my staff and I dressed up during the holidays. So I'm mainly located in Glendora, but we have 2 other offices in Upland and Rancho Cucamonga as well. But Glendora is our newest office, so we're branching out. So I know that previously Dr. Jung had talked about dental hygiene and cavities, but as an oral maxillofacial surgeon, I just wanted to talk about highlights a few procedures that pertain specifically to children and teen oral health. So these are the main procedures that we do. Just to briefly review about the dental decay process, our mouth isn't really a clean place, and so it has a bunch of bacteria, and when it comes in contact with food and drinks, it produces acid. And so when this acid stays on a tooth for a long time, it ultimately produces a cavity. And as the cavity extends and it gets deeper and it grows from the enamel, which is the white part of our tooth, to our nerve, as you can see on the picture on the right, the bacteria start to travel down the root apices and cause infection and bone decay or bone infection underneath, and ultimately an abscess is produced. And so when an abscess is produced, patients will not only complain of pain and swelling, but also complain of foul odor in their mouth and also bitter taste. And so we perform a procedure called incision and drainage. It's self-explanatory. As you see, I have a video here. This is a video where I saw this patient. He was 6 years old, and he presented with his right side of face swollen, and he had an abscess. And so this is kind of the procedure that we do. The patient is sedated. We use a blade after anesthetizing the patient to relieve all the pus and clean out all the infection afterwards. Majority of the time, if it's a baby tooth, a lot of these teeth are going to come out as well. So we're essentially the Dr. Pimple Popper, but inside the mouth. This is another self-explanatory procedure that we do. It's called Expose and Bond. It's a procedure performed when the adult teeth are impacted and they're unable to erupt, usually due to crowding. And so it's most common on the upper eye teeth, also known as the maxillary canines. And I'll show you in the picture here, you can see that the impacted canine is coming at an improper angle. It's buried underneath the gums. And so it's unable to erupt because it has all the other teeth in the way. And so what we do is we reflect the gums, and we're able to identify where exactly the tooth is. And we're going to attach a little chain, gold chain onto there, so that with the help of an orthodontist, we're able to pull that tooth down into the correct position. And so all the most of the photos I'll be showing are, cases that I've had within the past few months. And so in this patient, he's roughly around 11 years old. You can see one side, the canines erupting normally. And when it's in the normal position, it also helps the baby tooth to fall out on its own, because it resorbs the baby canine root. And so this side is the normal side. You can see that it's erupting in a proper position. On the other side, you can see that it's angulated and in an improper position. And this ultimately, one, will prevent it from erupting, and also prevents the baby tooth from coming out on its own. And so with the help of a 3D X-ray, we're able to see exactly where the position of the impacted canine is. I'm going to go back. You can see here that this is the erupted lateral incisor, and we don't know if it's, and from this picture, if it's in front or behind that tooth. And so using a 3D X-ray, we're able to see exactly where the tooth is. In this case, it's in front of the erupted lateral incisor. And during the exposing procedure, what I do is we make an incision underneath the gums and reflect it upwards, and then we remove a little bit of the bone because we know exactly where the location of the tooth is. And we also extract the primary, the baby tooth as well, so that it'll aid in the eruption process. During the bonding part of the procedure, what I do is I bond a gold chain with composite so that it's able to withstand the force of pulling without causing it to detach. And so afterwards, what we do is we reflect the gums back in position. So the only thing really sticking out of the patient's gums is the gold chain. And so over time, this picture will show that as the orthodontist is able to work with the gold chain and angulate the tooth so that it erupts into the proper position. And so depending on how severely impacted it is, the tooth can erupt either in a matter of months or potentially a year before ultimately coming back in place. So this is, before patient had braces, he was missing the canine, it was impacted. And afterwards, it's back in position after a series of braces and expose and bond procedure. So supernumerary teeth, this is an additional tooth beyond the normal series. It's most common in between the front two teeth. We call it a mesiodens. Majority of them fail to erupt and remain impacted. They're usually associated with syndromes, but I've seen a few cases where it's not related, or it's not syndromic, I should say, at all. And so this is a patient I saw recently. 7-year-old female, she had an extra tooth in between the front two teeth, also called a mesiodens. And so once again, we use a 3D x-ray to exactly locate the position of the supernumerary tooth. In this case, it's behind the erupted permanent teeth. And so with this data, we're able to know exactly where to reflect the gums. And so this is a photo before. You can see that the front tooth on your left side is slightly tilted. So these extra teeth prevent our permanent teeth from being angulated and erupting in a proper position. And so you can see that it's already tilted here. And so what we do, since we know the exact placement of this tooth, is we're able to create an incision along the gums, reflect it, identify the tooth, and remove it. And this is the picture of the extra tooth. So extraction of wisdom teeth is our main, so to say, bread and butter. There's no study showing the percentage of wisdom teeth or what percentage of people have wisdom teeth, but multiple studies show anywhere between 25 and 72%. They usually erupt between the ages of 17 and 25. And age plays an important role in when these teeth should be extracted because, as you can see on the picture on the right, as the tooth, patient grows in age, the tooth roots start to get longer and longer. So not only does this cause the wisdom teeth to be retained more tightly in bone, but it also gets closer to important structures in our body, such as the nerve or the sinus. And so the age is really important, and it's really important to understand the difference between asymptomatic and disease-free. So they say around 25 of the patients who are asymptomatic from their wisdom teeth already have some sort of gum disease that they do not know about. A lot of the time patients say, hey, it's not causing me any pain, but they don't realize that pain is actually the last thing that really, it's the last symptom, so to say, that occurs before any other disease. And they did a study, a long-term study, where 70% of the patients who had their asymptomatic wisdom teeth retained required removal later in life. And so this was an 18-year follow-up, and that exceeded over 70%. So the most common thing I get when I see patients is, my wisdom teeth is causing shifting of my other teeth. And so this isn't actually true. It doesn't cause any shifting, but it is painful, and it does cause a lot of other problems, such as infection, adjacent tooth damage, gum disease, we call it periodontitis or pericoronitis, or any pathology. And so this is just a photo of one of my patients. You can see that the wisdom teeth, the lower wisdom teeth, are coming in at an angle. You can see indicated by the red arrows, it's causing decay not only on the wisdom teeth, but also on the tooth in front. And you can see that by this circle as well. Reason for this being is that you're going to have a lot of food trap and saliva pool up there that you're not able to clean no matter how much you brush and floss. And so eventually these second molars may need to be extracted or require extensive dental treatment such as root canal, buildup, and crown. And so before any of these problems occur, it's best to take the teeth out, wisdom teeth out. And this is just an example showing that it can occur for the top teeth as well. Another reason is pericoronitis or periodontitis, which is gum disease. You can see that the gums over here are already swollen, and this can eventually spread backwards to your airway area. So reason this occurs, same thing, you're going to have a lot of food particles and little saliva trapping here that you're unable to clean, and as it builds up, it causes an infection. Wisdom teeth also can have pathology attached to it, and so you can see on the picture left here, you have a lesion that surrounds the wisdom tooth, and now it's compressing. It's gotten so big that it's compressing onto the nerve, and that's when the patients feel pain. And so pathology or pain cannot, pathology is always present before the pain. And so even though you're not feeling pain, that doesn't mean you have any sort of pathology. You're free from pathology, so to say. And so this is a patient that I saw recently too, 16-year-old male. He had no problems until a week ago. He said, oh, I'm having some sort of numbness on my lip and some pain in my jaw. And when we took an x-ray, you can compare the normal side here versus the affected side here with inside the red circle. You can see there's a huge shadowing surrounding the wisdom tooth. And so using the 3D, we can kind of compare the normal versus the abnormal side. The normal side is under the blue circle here. You can see it has a lot more tooth structure. You can see a lot of the outline of the bone versus the right side, or the left side, so to say. It's causing a lot of destruction of the bone, and the bone is also expanded compared to the other side. And so a lot of these cysts and tumors can not only cause destruction, but also alter your shape of your jaw. And so when I ultimately, this is the specimen after I shelled it out. And what we do is we send these lesions to in formalin solution, and we send it to a pathologist where they are able to dissect this and look under the microscope to see what type of cyst or tumor it is, and if there's any additional procedures that needs to be done to take care of the jaw. And so this is just a picture that I took a day afterwards. You can see that the tooth is entirely encased within this cyst. And last but not least, I wanted to talk about orthognathic surgery. And so this is a procedure used to realign the jaws and improve not only cosmetic, but also for functional purposes as well. And so if you break up the word, ortho means straightening, gnathic means relating to the jaw. So we're essentially just straightening the jaws. This is a funny picture that I found online, kind of showing the class 1, class 2, class 3, different types of skeletal malocclusions, and it's comparing it to dogs and humans. And so class 1 is the ideal type that we want, and about 75% of the population have class 1 occlusion. Class 2 is essentially just an overbite, and about 20% of the population have this malocclusion, and class 3 is a severe underbite, in which only 5% of our population have. Reasons for doing orthognathic surgery is not only its difficulty biting, which, as you can assume, anybody with significant underbite and overbite could have difficulty chewing on some food, but it can also be cosmetic or medically necessary, such as obstructive sleep apnea or temporomandibular joint disorders, or any asymmetry of the jaws, whether patients are born with them or it's related to trauma. And so this is a recent video of a woman getting viral on TikTok because she documented her entire transformation before and after orthognathic surgery. So this is just she was on Daily Mail, Yahoo News, and she became really famous just documenting every step of the jaw surgery process. And so I'll show you the overall change. Even after 1 month after jaw surgery, you can see that she has a significant different profile. Her lower jaw is significantly well defined. And so just to show you guys a quick video, this is someone with a significant class 3 malocclusion. Majority of the time, we're going to work with an orthodontist who is going to put braces on to level and align the teeth. A lot of times when the orthodontists do this, they're going to make the bite slightly worse before we do surgery and make it better. And majority of the time, these patients are going to need double jaw surgery. So we're not just going to move one jaw, we're going to move the other jaw as well. And so we intentionally cut the jaw and remove a segment of it so that we can position it in the proper position. And then we're going to use a 3D guided splint so that we can stabilize it before putting our titanium screws and plates in position. And then afterwards, we're going to work on the upper jaw and then make our bony cuts there before finally putting them in proper occlusion and bite and stabilizing those with titanium screws and plates as well. And then afterwards, so this is a patient that I performed surgery on during residency. You can see that in her profile view, she has a midface deficiency as well as a protruded lower jaw. And she complained about a few things. First off, her joints hurting, but also she's unable to chew properly. And she also didn't look like the cosmetic look of it. And so we performed surgery. And this is how she looked afterwards. You can see that her mid-face is significantly more full and that her lower jaw has come back a lot so that she's able to have a more balanced facial profile view. Overall, I want to thank the San Dimas Rotary Club, everybody for having me. In conclusion, this is just a small set of procedures that we do, but pertaining specifically to children and teen oral health. And I look forward to helping out the community, and thank you for having me.
Thank you so much for joining us. I mean, some of the pictures were a little, but honestly, throughout the whole thing, I was just like thinking of my teeth the whole time. But we're opened up for questions. Anybody have any questions?
Well, I gotta say, Diva, I was watching all of us, and I've never seen us so interested in anything that was
I was writing, I mean, I always write notes, but I was just like, oh, I need to ask him this question.
That was one of the most informative dental things I think I've ever seen. My hat's off to you, because there's things that have happened. I'm one of those late erupters on or late wisdom teeth guys. Yeah, that's the way it works. Now I see what's going on.
You lost me at I'm a late erupter. Hey, Raymond, I didn't hear anything after you said I'm a late erupter, huh?
Thank you very much. That was very, very good. All right, go ahead.
Thank you.
I had a question, Dr. Kim. So being that if someone that gets the top and the bottom jaw surgery done, the top, does it cause, like once they do the surgery, does it cause any sinus problems? Has anybody had that? I don't know why it popped into my head.
Yeah, so I mean, some patients have sinus problems. They have a lot of congestion problems but we give a lot of anti-decongestants, so to say, to help with that.
Okay,
And
so
with our 3D x-rays, if they have any sort of pathology, that's something that we biopsy prior to doing the jaw surgery itself. And so depending on what that pathology is, we either postpone surgery or we go ahead and continue on with surgery. And so it's pretty much the process behind that.
Very cool.
yeah.
Danny,
Thank
I know that others have already affirmed your presentation. I'm grateful for your personal passion, your conviction, your giftedness, your talent. Praise God, there's people in the world that can do what you do. And I just affirm your presentation was concise, succinct, and I think somebody else is going. I think I learned more about my own teeth in your presentation today than I could have captured in all my years of, and I have been down the orthodontal path. I've had all sorts of different journeys. So thank you for what you bring. And I just invite you to explore what the Rotary can bring to your field. You know, there's a whole rotoplast and a whole, I'm not saying those are equated, but where you want to partner and be connected and use your talent to serve and to change the community, by all means, lean into us. And so glad that I'm assuming Craig reached out and brought you in here today. So
yeah,
we're grateful for Craig and who he is and what he brings, and we affirm you as well.
Thank you so much. I appreciate it.
Thank you very much. Any
Yeah.
other questions?
Yeah, just kind of a comment. Yeah, very interesting. I had one of my wisdom teeth impacted growing in that sideways, and it was interesting to see the X-rays and the model because it did feel like it was condensing the bite, and so it's interesting to hear it's not actually the case. It's and see what's actually going on. But yeah, very interesting. Great presentation.
Awesome. Thank you.
Of course, Craig pops in when it's all over with. Thanks, Craig.
Here.
He probably knows this stuff.
Oh, he definitely knows it. He doesn't need to come in for that.
I planned it perfectly. But sorry for being so late.
Oh, nice for you to drop on in.
Craig, the only thing we complained about is you didn't give us fair warning not to eat lunch during the presentation.
I didn't know what he showed you guys, but I guess it wasn't the prettiest.
We've been exposed. It's mind altering.
I really want to clear my calendar just to see my dentist and orthodontist. Literally, I was thinking that the whole time while he was talking.
Oh, good job, Danny. You motivated everyone.
I was like, my kids too, we all gotta go now. Thank you again. So we'll go ahead, and if there's any other questions, we'll make sure that we'll save those to the end and give it to Dr. Danny Kim. Thank you again for joining us. So our next speaker, or our Fast Craft Talk, is with Sister Terry Dodge.
Well, thank you for having me. I think your type of talk, Fast Craft Talk, is interesting. So I'll see how fast I can talk for you, and you can shut me off at the 5 minutes, definitely. I have been the executive director of Crossroads here in Claremont for the last 32 years. And I think it's very important that people know about Crossroads and why Crossroads is so very important. We are having a fundraiser starting February 14th. It's a virtual walk type of fundraiser because of the pandemic. But what is so important to realize is that as a nonprofit, as an agency that is working with formerly incarcerated women, what a tremendous savings we bring to the community. The 1819 statistic for the cost of incarcerating one person in a California state prison is over $81,000. And of that, almost 75% of it is for security and health care. less than 3% is used for education and rehabilitation. So what Crossroads does, and what Crossroads has been doing over the last number of years, is helping women become independent in the community and be contributing members in the community. And what we actually do for the public is, if you want to just talk money, which is often the starting point for so many programs, is we save over $2 billion a year to the state fund in California. That's having 30 women successfully reintegrate in the community and not go back to prison. It is more expensive being a small agency. We do not warehouse. I never have more than 2 people in a bedroom. I never have more than 6 women in a house. So it really is a home-like situation where the women who come to Crossroads don't get lost in the process. Now, our fundraiser, which I think is what originally brought the invitation to speak today, is looking for support for this fundraiser, either as the Rotary Club helping to sponsor, or individuals signing up to do the virtual walk or sponsor me. I'm the one speaking, so I want you to sponsor me, obviously. But rather than just a virtual walk, I often get myself into situations and I wonder, anyway, I made the suggestion that I walk from CIW, which is in Chino, to our house in Claremont on Harvard, which is across just below Foothill Boulevard on Harvard, across from Wolf's, if you know the Claremont area. And that's a total of 15.3 miles. So and I also said that I would raise $20,000. And all of it is because of the women I have worked with over the past 32 years. The event is called Walking Home. And to me, my commitment to this is it represents the women who continue to call Crossroads home. And I think of them and the stories that they have shared with me over the years. And I think of the number of women, the letters that I get on a regular basis of women asking to come here. So my walk of 15 miles is representative of the women who have walked home to Crossroads and those who dream of walking home to Crossroads in the future. So, am I under 5 minutes?
You are indeed. And
Did I get my point?
And
That's
you're
more important.
And you're our guest speaker on April 14th, right?
Yes, yes. So I can tell you much more about Crossroads then.
We're interested in. And when is your virtual walk?
It is March 14th through March 28th. I am actually walking from the prison on the 14th, Sunday the 14th.
Okay.
What time are you walking?
I'm hoping to leave the prison at 5 a.m. in the morning. But the walk itself, it really is virtual. There's a gentleman in, I moved into Pilgrim Place last October, and there's a gentleman who is walking from one street corner to the next on his block in his walker, and that's his walk for Crossroads. There's the Pilgrim Pacers are also going to do a 1 to 5K walk around the complex on St. Patrick's Day on the 17th. And I will walk with them, as well as several of the women from the house walking with them on the 17th. But it's a situation where, because of COVID, you all know the reality of that. So it's a virtual walk. You can walk. We will believe whatever you say, but there are a few people that are actually going to be walking, but it's over a period of time that it's available for that. You can find us through our website, crossroadswomen.org. And from there, you can go to the there's a separate website for the walk itself. You could go directly to my link for sponsorship, hint, hint, are you getting my hint? Which is run sign up Sister Terry, I believe it is. Or you could just go to our website and make a donation through PayPal. All
Perfect.
would be appreciated.
Thank you very much, Sister Terry, and I can't wait to have you on here on the 14th so we can hear more about the organization and what you do for these women. So thank you very much.
I look forward to it. Thank you for the opportunity.
And are you okay if I'm gonna go on your site? I'm also gonna attach the link to my my social media. Is that
Sure.
okay?
Absolutely.
Perfect.
Great.
Right,
Thank you.
Thank you. Alrighty, next is Casey with the Fine Master.
I love your question. Is it okay if we promote you, Sister Terry, to let everybody know that you're raising money for a fabulous cause, and then we can have you back and celebrate you? I think that's
Absolutely. Absolutely. Thank you. I
Beautiful stuff.
appreciate that.
The fine time. This is our fine time. It's where you get to say, this is fine, I'm fine, you're fine, or something's not fine. And we're going to charge you a fine talk. It's actually self-imposed. So if you'd like to make a donation today to the Rotary and you want to get on your soapbox in time, you just speak up and say, this is what's fine, what's not fine, or talk fine about somebody else. Who would like to find themselves first?
Mike's reaching for the unmute button. I can see it happening. Hey, so I'll go ahead. Go ahead, Craig. Take the floor.
Oh, I was gonna find myself $20 just for being so late for Danny's presentation, and then I missed my other guest presentation a couple weeks ago too. So $20 for myself.
It's accepted, Craig, and yet your delinquency is not acceptable. So we'll take your money and just don't do it again.
Sounds good.
Terry, Casey, I'll go for $10. You know, when the pandemic started, I moved what I do virtually and began to do presentations really around the world. And I have one set for Friday night, and it started out fairly small, but now 800 people have registered for an hour-and-a-half lecture I'll be giving Friday night. And so it's really blossomed, and I think that's worth $10.
Awesome. Well done.
I'll go. I'm gonna find myself $10 because not only do I have exceptionally clean teeth, but I also got to see Craig in person yesterday, which was very nice. And yeah, got my teeth cleaned and got to see a fellow Rotarian in the flesh in the same room. So that was great.
Go ahead, Diva.
So let's see. I'll find myself $5 for being a minute late. And also I just want to tell Craig, I'm gonna be calling your office because literally it's been on my mind since Danny started talking. I'm like, okay, I gotta go.
Danny, you just laid this down.
I really got to go to the dentist now, and after that, after my cleaning, I got to go see the ortho because, you know, I stopped wearing my retainer probably. I don't think I ever even wore my retainer after my braces.
I was gonna say 20 years ago.
Yeah. So now I need to get that fixed. So yeah. So there's my.
Fabulous. Well, I'll jump in on the fine train. And Danny, I have told all of my children that I didn't have to have my wisdom teeth extracted because I used all of my wisdom up and it migrated to my crown. So I'm celebrating that I'm fine, that I haven't had impacted wisdom teeth because I utilized it all. I do have my middle son who's got a consultation about possibly extracting his wisdom teeth coming up in a couple weeks. So I'm going to look into that. Danny, how do I find you if I wanted to have you take a look at him?
You can give our office a call at Inland Empire Oral Maxillofacial Surgeons. I'm located in the Glendora office. So if you give our office a call, they'll be able to schedule you.
All right. Thank you.
No problem.
Well, our time is fine, and it is also expensive. So let's keep moving and enjoy what we got next.
Thank you, Casey. So next is the Action 360, and I'll pass it on to Raymond for the first item.
The Welcome Back project with BUSD, you know, we have $1,000 on the table from the 4 organizations. We are simply waiting. I've had conversations in the last 48 hours with 3 board members and an assistant superintendent. They believe they're on track for April 5th. So we're kind of waiting to hear. And as soon as we do, I'll pull the trigger on getting a committee together to get that done. So that's where we are. I did receive Casey's email. I think we'll be able to cover the 8 schools or 9 schools with the $1,000 and the Welcome Back art. So the project's ready to go. We're just waiting.
And Raymond, it's still just the elementary schools, right?
Yes, those are the ones will be opening on the alternative pod type day. So it'll be a 2-day event essentially, because the kids are on an alternating schedule in what they're calling pods now. So we'll have to see. Right now, they must begin vaccinating teachers within the next week to make this timeline.
Yeah, okay. Okay, thank you very much on that. And now books for the Philippines.
Waiting for confirmation back from the Philippines on the proper Rotary Club for us to partner with. This is a long-term project, probably going to be kicking off, if we do it, sometime after my year begins. That's all we have.
Okay, perfect. So next is the district governor's visit. Funny, he just actually replied to me. He just said, he's confirmed he's going to be there. I did reach out to the assistant governor. I still need to get confirmation if she's going to join us on that meeting. We did receive our the certificates back for so that we can induct do the inductions for the 2 new members. Now, do we want to do that day on the next week, or is it? It's already next week, right? So do we want to do it via Zoom, or do we want to do it in person?
I would send an email back to the governor, tell him we have these people to induct. Would he like to do a brief ceremony on Zoom? We can always follow up in person, but it's very nice to be inducted by the governor.
Right.
So I would, and I need to know that so I can put it in this tight agenda we're going to have. And also, I know everyone is here, but we need everyone to be here for the governor's visit. Block out the time.
The date, Diva?
It's the 3rd. It's next Wednesday. Do you hear me, Marianne?
Did, thank you.
Okay, perfect. Okay. Now next, or do we have any other questions on that, on the governor's visit? No? Okay. Next is also, we have our board meeting. I just wanted to mention, we're going to do it March 4th, which is Thursday at 6 p.m. So if you can't make it, or if you have other questions, just email me. Okay. So next is the calendar. Thank you, Raymond, for adding that. So I am pending for March 17th to get a speaker from the Philippines, the U.S. Department. So I'm waiting to see if they're willing, or if I can get somebody to do it. And as soon as I find out, I should find out probably by tomorrow if they can make it or not. If not, it will jump to April. Alrighty. Next, Mike with or is it Mike or Craig for the 4-way test?
Craig.
Oh, sorry, Mike. Are you there, Craig?
So the 4-way test, I don't have, oh, it's in front of it. So it's of the things we say or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned? So just if you don't know, this is a code of conduct for all professionals to to live by and conduct business with. I think the one way to think about it is when you play a game, In games, there's always a winner and a loser. But with the four-way test and with business or in life, ideally, any transaction, there should always be winners on both sides. And so the customer should always get a great service or a great product, and the in exchange for money or another type of service. And so it's basically everyone should benefit in the business world, which doesn't always happen, but I think that's a good way to kind of think about how to go about living a good life in general. And that's the four-way test.
Thank you, Craig. So I want to thank everybody for joining us. I did want to end today by saying, since it is, yesterday on the 24th or 23rd of February is when, in 1905, like I mentioned earlier, is when, a gentleman named Paul Harris decided in Chicago to start a club. And look, from that point, he probably didn't realize what this was going to cause and what it was going to do, but he knew he needed to do something. Fast forward to today, I have conversations with people that might never have known what Rotary was, and they call me and ask questions, because the more that they see that what I do and when the people we help out, and by posting these things via social media and even having them watch our live feed, or I should say when we post it on that public access channel, it's opening up people's eyes that would have never otherwise been familiar or attached to this this program or this organization. And I want to thank you guys, because of every person on here is the reason why I joined. I didn't even know what Rotary was. I didn't know it existed. I knew it was some sort of club, but I didn't know what it was. But the things that I've learned and throughout the years that I've just gotten to know everybody and gotten closer to my community, it's just a great opportunity. And I want to just thank everybody on here, as well as those that are watching, to come in and join us and see what we do. So thank you again. Have a great week. Nice to see all of you, and see you next week. Bye.